The Journal of Orthopedic and Sports Therapy says that the rate of low back MRIs in the United States is really growing at an alarming rate, despite evidence that it does not improve patient outcomes. Do you both agree with this? Is there something that needs to be done differently, Claudia?
Patients initially, when they come to us, a lot of time they're in acute pain and they're thinking, just because I'm having acute pain, that means that it's a surgical, it's an emergency. Acute pain means that your body's having inflammatory processes. There are things that can be done, medication. Sometimes we have to brace the patient, but it doesn't constitute an emergency. Like Dr. Mena was saying, weakness, dragging their foot, inability to move, inability to empty their bowel or their bladder, those are emergency things that need to be focused on, but acute pain is something that can always be treated conservatively. It's not an emergency.
So why do patients think do patients walk in saying, I got a back problem, doc, I need an MRI? Are they telling you how to do your job?
Yes, sometimes.
A lot of times? So why? Why do people do that?
A lot of time they think that the MRI will give the diagnosis like right on the spot, and sometimes they might have heard some family members that they might have a history of cancer and they found that on the MRI. To tell a patient, normally the chances of finding cancer on MRI is less than 0.4%. So it's extremely low, and normally, as I said before, with the history, we might be able to tell what's going on, have a better idea, and that will lead us to, if we need to get an MRI right on the spot, we will get it. But the MRI will get a lot of jargon, a lot of words that a lot of people, unfortunately, will go into Google and they will start like looking spondylosis, foraminal stenosis, disc herniation, disc bulges, spondylolisthesis, and they will start getting confused. And there's a lot of terminology that's normally, as we age, that's things that we're gonna get in the imaging. So our role as a physician or clinician will be, once we have a history and a physical, we have a concrete idea, will be just to match what's going on the patient with the MRI and tailor the treatment accordingly.